So I'm here with the M22, and what's beautiful about the M22 and why it's probably my most favorite procedure to perform, specifically the photofractional treatment, is that you have the IPL device, which is probably the most popular energy-based treatment that we deliver here in our practice. And now we can combine it with the 1565 nanometer erbium laser that allows us to more effectively treat into the dermis, stimulating new collagen production and really helping improve fine lines and wrinkles. Because ultimately, someone who has some level of redness and brown that comes with overall photo damage usually has some level of wrinkles too. And so you can more globally rejuvenate their skin when you're able to target both. So what's nice about this technology and why it really fits in and makes sense for us from both a financial perspective but a logistical perspective is that you have two devices that we use very commonly all in one. And so you're able to basically treat with an IPL and immediately after treatment just switch over to the ResurFX without having to change a handpiece or move to another room or put a tip on. And essentially, within a minute, we're able to switch over to the 1565 nanometer erbium. So we're able to add on this treatment very easily to the IPL treatment, which is the most common and most popular procedure here in our practice. And so essentially, in that time that I've been talking, it's already been warmed up. And so this is essentially the laser. And what's beautiful about this device is that you have different parameters that allow you to essentially combine about 600 different combinations all in one treatment. So you have not only the ability to change the spot to one that's a circle, rectangle, hexagon, square, but you also have the ability to change the size of that spot, whether it's 10 millimeters, 12, 15, or 17. And so it allows you to customize the treatment, whether you're trying to treat a linear striae or stretch mark, or whether you're actually trying to treat a boxcar scar, perhaps maybe square, or whether you're actually trying to treat the full face with perhaps a more rectangle or square shape. And so additional features on the device which make it nice, well, being small and being a woman, it makes a difference that the actual handpiece that I'm dealing with is ergonomically makes sense. And so here it's light. I don't have to worry about something heavy and bulky. And so I'm able to perform this procedure at least 5 to 10 times a day. And it really doesn't affect me, to be honest. In addition, it has this cooling tip, the sapphire tip that allows me to protect the skin, specifically the epidermis when I'm delivering a pulse, so that I can treat my darker skin types more effectively and efficiently without concern of post-inflammatory hyperpigmentation. In addition, the actual glass allows me, in the tip, allows me to visualize the beam when it's being delivered so that I'm able to see what I'm treating without concern that I'm going to overlap accidentally. And what makes even more sense and what I particularly like is when I deliver a pulse, the non-sequential scanner that's proprietary to the CoolScan system that Lumenis has allows me to deliver the microbeams randomly in a non-sequential pattern so that I don't have to worry about leaving stamps behind. So essentially, I'm able to perform a 1565 nanometer erbium treatment immediately over my IPL, and I don't have to worry about adding more cost to my patient's treatment when you know they're going to need about 3 to 6 treatments because of the lack of consumables. So I'm able to pass that savings on to my patient.